Question 1. In the context of CT imaging, Mr. Douglas, a radiologic technologist, is preparing to conduct a head CT scan on a patient. He has noticed that the patient is experiencing significant movement during the procedure. What should Mr. Douglas do to minimize motion artifacts and ensure optimal image quality? A. Increase the patient's sedation level to ensure they remain still. B. Use faster scan protocols to capture images in a shorter time. C. Instruct the patient to hold their breath and minimize head motion during the scan. D. Increase the radiation dose to improve the clarity of the images. Answer. Correct answer. B. Explanation. Motion artifacts occur when the patient moves during the scan, causing blurring in the images. To minimize this, the best approach is to reduce the scanning time as much as possible, which is achieved through faster scan protocols. Option B directly addresses this concern. Increasing sedation may not always be necessary and can be avoided where impossible, especially in non-emergency situations. Option C can help, but faster protocols are more efficient in minimizing motion. Increasing radiation dose D is not a recommended approach as it contradicts the ASRT as low as reasonably achievable principle of radiation protection. Question 2. Which of the following is true regarding beam hardening artifacts in CT imaging? A. Beam hardening artifacts are caused by the attenuation of the X-ray beam as it passes through soft tissue. B. These artifacts often appear as dark bands or streaks in the final image and can be reduced by adjusting scan parameters such as kVp. C. The artifacts caused by beam hardening are most commonly seen in low-density areas such as bones. D. Beam hardening artifacts do not affect the diagnostic value of the CT scan. Answer. Correct answer. B. Explanation. Beam hardening occurs when the X-ray beam becomes harder, i.e. higher energy, as it passes through denser structures like bone. This causes darker streaks or bands in areas with high density, such as around the skull or spinal column. This artifact can be minimized by adjusting parameters like the kVp, millivolt peak, which affects the energy of the X-ray beam. Option B is correct as it directly addresses the nature of beam hardening and how to reduce it. Options and C confuse the causes and impacts, while D is incorrect as these artifacts can indeed compromise diagnostic quality. Question 3. In light of recent developments in CT imaging technology, what is the most effective method to reduce radiation dose without compromising image quality for a pediatric patient? A. Use a standard adult CT protocol and increase the number of images captured to compensate for reduced exposure. B. Adjust the CT protocol to account for the patient's size and age, employing dose modulation and reducing the scan range when possible. C. Limit the amount of contrast media used as it has a direct correlation with radiation dose. D. Increase the tube current MAR to enhance image clarity, which compensates for the smaller patient size. Answer. Correct answer. B. Explanation. For pediatric patients, it is essential to adjust the CT protocols to their size and age to reduce radiation exposure in compliance with the ASRT principle. This includes using dose modulation and limiting the scan range, which adjusts the radiation dose to the specific needs of the patient. Option B is correct because it aligns with current guidelines for pediatric imaging. Using an adult protocol A increases the risk of overexposure. Option C is not directly related to reducing radiation dose. Increasing tube current D could inadvertently increase radiation exposure. Question 4. When analyzing the impact of noise on CT image quality, which of the following statements is accurate? A. Noise in an image is typically caused by an excessive signal and is therefore a result of improper imaging techniques. B. Noise can be reduced by increasing the number of detector rows in multi-slice CT scanners. C. Noise is inherently present in all CT scans and can never be fully eliminated but can be minimized by optimizing scan parameters. D. Noise is most detrimental in low-density areas such as the brain and chest where resolution is critical. Answer. Correct answer. C. Explanation. Noise in CT imaging is a result of random fluctuations in the signal received by the detectors and is an inherent part of the imaging process. While it cannot be completely eliminated, its impact can be reduced by adjusting the scan parameters, e.g. using higher or longer exposure times or employing noise-reducing software. Option C is correct because it accurately reflects the reality of noise in CT imaging. Option is incorrect because noise is caused by the lack of sufficient signal, not an excess. Increasing detector rows. B. Addresses spatial resolution rather than noise. Option D is incorrect as noise can affect any part of the image but is often more noticeable in areas of low density. Question 5. Mr. Harris, a radiologic technologist, is preparing for of a patient with a metallic prosthetic implant. What should Mr. Harris do to minimize metallic artifacts that may arise during the imaging process? A. Use a lower kVp setting to reduce the interaction between the X-ray beam and the metal object. B. Increase the tube current to improve the image quality around the metal object. C. Adjust the patient's positioning to ensure the metallic object is not within the primary X-ray beam path. D. Apply metal artifact reduction algorithm, which is available on the CT scanner. Answer. Correct answer. D. Explanation. Metallic artifacts are commonly caused by the attenuation and scattering of the X-ray beam as it passes through metal objects. These artifacts can be reduced by applying specialized algorithms designed to handle metal artifacts, such as the metal artifact reduction (MAR) algorithm available on many modern CT scanners. Option D is the most effective solution. Lowering kVpa or adjusting the tube current. B. Does not directly address metallic artifacts. Changing patient positioning, C, may help, but it is not always feasible and does not guarantee artifact reduction. Question 6. Which of the following is the most effective method for minimizing the biological effects of ionizing radiation in CT imaging? A. Always use the highest possible radiation dose to achieve the clearest image possible. B. Employing the ALARA principle as low as reasonably achievable and optimizing scan parameters to minimize radiation exposure. C. Use ionizing radiation only when absolutely necessary and avoid CT scans altogether if possible. D. Shield all patients with lead aprons to prevent exposure to ionizing radiation. Answer. Correct answer. B. Explanation. The ALARA principle is central to radiation protection and requires that radiation doses be kept as low as possible while still achieving sufficient image quality. This can be achieved by optimizing scan parameters, adjusting radiation dose according to the clinical indication, and using the lowest dose necessary. Option B is correct because it reflects current radiation protection guidelines. Option is not advisable as high doses are unnecessary and increase the risk of radiation-induced injuries. Avoiding CT scans altogether. C is not a practical solution as CT is essential for accurate diagnosis. Shielding. D is important but does not address the core issue of minimizing radiation dose during the scan. Question 7. According to recent studies, what is the primary benefit of using automatic exposure control in CT imaging? A. EEC improves image resolution by automatically increasing the tube current during the scan. B. EEC helps maintain a consistent radiation dose across various patient sizes and anatomical regions. C. EEC reduces the overall scan time by minimizing motion artifacts. D. EEC allows for increased patient throughput by reducing the time spent adjusting scan parameters. Answer. Correct answer. B. Explanation. Automatic exposure control. EEC adjusts the radiation dose based on the patient's size and the density of the area being imaged. This helps maintain a consistent and appropriate radiation dose for different patients and anatomical regions, reducing unnecessary exposure. Option B is correct because it highlights the primary function of EEC. Option incorrectly associates EEC with improved resolution, which is not its purpose. While EEC can help with scan time, C. Its main function is dose optimization. Option D is not correct as EEC does not directly impact patient throughput. Question 8. The evolution of CT technology has allowed for more accurate imaging of soft tissues. In this context, what role does contrast media play in improving soft tissue visualization in CT imaging? A. Contrast media increases the density of soft tissues, making them easier to differentiate from surrounding structures. B. Contrast agents work by decreasing the attenuation of X-rays in soft tissues, which enhances the overall image quality. C. Contrast media helps to highlight areas of interest, such as tumors or blood vessels, making them stand out against surrounding tissues. D. Contrast agents reduce radiation exposure and for more scans performed in a shorter amount of time. Answer. Correct answer. C. Explanation. Contrast media is essential in CT imaging for improving the visibility of structures with similar densities such as soft tissues. By enhancing the differences in attenuation between tissues, contrast agents make areas of interest like tumors or blood vessels more distinguishable. Option C is correct as it highlights this use of contrast agents. Option is incorrect because contrast agents do not increase tissue density but alter X-ray attenuation. Option B is also incorrect as contrast agents do not reduce attenuation in soft tissues. Option D is not accurate as contrast media does not reduce radiation exposure. Question 9. In terms of radiation safety regulations, which of the following actions would most effectively reduce a patient's radiation exposure during A can decrease the tube current more to reduce radiation dose even at the expense of image quality. B. Increase the number of slices acquired during the scan to improve diagnostic accuracy. C. Use the appropriate scan protocol based on the patient's clinical condition and body size. D. Use higher kVp settings to enhance image clarity. Answer. Correct answer. C. Explanation. The most effective way to reduce radiation exposure while maintaining diagnostic image quality is to use the appropriate scan protocol tailored to the patient's clinical condition and body size. This allows for the lowest necessary radiation dose. Option C is correct because it aligns with the ALARA principle of lowering the tube current. A can reduce dose but may compromise image quality. Increasing the number of slices. B could increase the dose without necessarily improving diagnostic accuracy. Higher kVp settings. D could lead to higher doses and are not always necessary for improved image clarity. Question 10. What is the primary risk associated with the use of CT imaging for pregnant patients, and how can it be mitigated? A. CT imaging poses no significant risk to pregnant patients as the radiation dose is minimal. B. The primary risk is the potential exposure of the fetus to ionizing radiation, which can cause birth defects or developmental delays. C. Pregnant patients should always undergo CT imaging as it provides the most accurate diagnostic information. D. CT imaging should be avoided entirely in pregnant patients, even when indicated. Answer. Correct answer. B. Explanation. The primary concern with CT imaging in pregnant patients is the potential exposure of the fetus to ionizing radiation, which can lead to birth defects or developmental issues, especially during the first trimester. Option B is correct as it reflects current guidelines for pregnant patients. While CT imaging can sometimes be necessary for medical reasons, it should only be done if absolutely essential with efforts to minimize radiation exposure. Option D is too extreme as CT may be necessary for certain clinical conditions, but radiation dose must be minimized. Question 11. In the context of motion artifacts in CT imaging, which of the following techniques is most effective in minimizing these artifacts when imaging the pediatric patient? A. Increasing the slice thickness. B. Using a higher kVp setting. C. Reducing scan time and using sedation. D. Using a lower mass setting. Answer. Correct answer. C. Reducing scan time and using sedation. Explanation. Motion artifacts in pediatric patients can be particularly challenging due to the difficulty in maintaining stillness during scanning. Reducing the scan time and utilizing sedation or immobilization techniques can help to minimize patient movement and improve image quality. A higher kVp setting may increase the likelihood of scatter, leading to artifacts while using. Mass setting can result in insufficient image quality. Increased slice thickness can also compromise resolution and is not the preferred method for reducing motion artifacts. Question 12. When considering radiation protection for pregnant patients undergoing CT, which of the following is the most appropriate course of action for acne of the abdomen in the early stages of pregnancy? A. Proceed with the scan as normal, with no changes. B. Use a lead apron to protect the fetus during the scan. C. Perform the scan with a reduced radiation dose using automatic exposure control. D. Postpone the scan and explore alternative imaging methods such as ultrasound. Answer. Correct answer. D. Postpone the scan and explore alternative imaging methods such as ultrasound. Explanation. The early stages of pregnancy are A critical time in fetal development and exposure to ionizing radiation should be minimized whenever possible. When performing CT scans on pregnant patients, alternatives such as ultrasound or MRI should be considered first, as they do not involve radiation exposure. If EEC is absolutely necessary, the use of dose reduction techniques such as EEC and appropriate shielding should be utilized. Lead aprons cannot fully protect the fetus from radiation exposure, particularly in the abdominal area. Question 13. During the process of CT imaging, which of the following artifacts is most likely to result from the presence of metal objects in the imaging field? A. Ring artifacts. B. Beam hardening artifacts. C. Motion artifacts. D. Partial volume averaging. Answer. Correct answer. B. Beam hardening artifacts. Explanation. Beam hardening artifacts are a common issue when imaging patients with metallic implants or other metal objects in the field of view. The metal absorbs or scatters X-rays, causing the remaining photons to become harder or more energetic, resulting in a streaking or dark banding artifact on the images. Ring artifacts are typically associated with older CT scanners and can occur malfunctions in detector calibration. Motion artifacts are related to patient movement, while partial volume averaging is caused by averaging tissue densities in a voxel, usually affecting small structures. Question 14. Given the circumstances of a patient presenting with severe abdominal trauma, which of the following CT protocols would be most appropriate for initial trauma evaluation? A. Low-dose abdominal CT without contrast. B. Abdominal CT with oral and intravenous contrast. C. High-dose abdominal CT with oral contrast only. D. Non-contrast CT of the abdomen followed by contrast-enhanced CT if needed. Answer. Correct answer. D. Non-contrast CT of the abdomen followed by contrast-enhanced CT if needed. Explanation. In the context of trauma, non-contrast CT is often performed first to quickly assess for life-threatening conditions such as hemorrhage or large organ injuries. If no major injuries are identified, the scan can be followed by contrast-enhanced CT to better evaluate the soft tissues and vascular structures. Oral contrast is generally not necessary in the acute setting and might delay imaging. Using a high dose of radiation or contrast without proper indication can increase the patient's risk of complications. Question 15. From a radiation protection perspective, which of the following is the most effective technique to minimize patient dose while maintaining image quality in a pediatric CT scan? A. Use the highest possible mass to ensure clear images. B. Use the smallest possible scan area to limit exposure. C. Use a standard adult CT protocol with no adjustments. D. Increase the slice thickness for reduced radiation exposure. Answer. Correct answer. B. Use the smallest possible scan area to limit exposure. Explanation. To minimize patient dose in pediatric CT imaging, it is essential to use the smallest scan area that includes only the necessary anatomy, which reduces unnecessary radiation exposure. Pediatric protocols should be adjusted to accommodate the child's size and body type, typically reducing both mass and kVp. Using a standard adult protocol with adjustments may lead to unnecessarily high radiation doses. Increasing slice thickness might result in reduced image resolution, which could compromise diagnostic quality. Question 16. In terms of CT angiography ETA, which of the following statements is most accurate regarding contrast media selection? A. Non-ionic iodinated contrast media are generally preferred for CTA due to their lower osmolality. B. Barium sulfate is the contrast media of choice for CTA due to its high attenuation. C. Low osmolality contrast media are avoided in CTA due to their potential to cause kidney damage. D. High osmolality contrast media provide better image resolution for ETA than non-ionic options. Answer. Correct answer. A. Non-ionic iodinated contrast media are generally preferred for CTA due to their lower osmolality. Explanation. Non-ionic iodinated contrast agents are preferred in CT angiography because they have a lower osmolality, reducing the risk of adverse reactions, particularly renal toxicity. High osmolality contrast agents can cause more severe reactions and are no longer commonly used in CTA. Barium sulfate is unsuitable for CTA because it is not soluble in blood and would cause embolization if injected. Non-ionic contrast agents also offer better imaging quality than high osmolality alternatives. Question 17. Which of the following is the most important consideration when setting scan parameters for a patient with a suspected brain hemorrhage on CT imaging? A. Increase the KVP setting to maximize contrast between brain tissue and blood. B. Use the lowest possible mass setting to minimize radiation exposure. C. Employ a high-resolution protocol with thin slices to enhance visualization of small bleeds. D. Use a standard head CT protocol without adjustments for suspected hemorrhage. Answer. Correct answer. C. Employ a high-resolution protocol with thin slices to enhance visualization of small bleeds. Explanation. When imaging a patient with a suspected brain hemorrhage, it is crucial to use a high-resolution protocol with thin slices to accurately visualize small or subtle bleeds. Thin slices increase the spatial resolution, which is essential for detecting small blood collections. Increasing KVP may reduce contrast differences. Brain tissue and blood, making hemorrhages harder to detect. Reducing mass to minimize radiation exposure should be balanced against the need for high-quality images for accurate diagnosis. The standard protocol may not provide the required resolution for hemorrhage detection. Question 18. When analyzing CT image quality, which of the following factors is primarily responsible for partial volume averaging artifacts? A. The size of the pixel elements in the detector. B. Inadequate collimation of the X-ray beam. C. Using a high mass setting. D. The thickness of the CT slices. Answer. Correct answer. D. The thickness of the CT slices. Explanation. Partial volume averaging occurs when tissues of different densities are included within the same voxel. This is more likely to happen with thicker slices as they average the densities of multiple structures within that slice. This results in a loss of spatial resolution, making it difficult to accurately distinguish small objects or lesions. Thin slices reduce partial volume averaging and image clarity. Collimation, mass, and pixel size are also important for overall image quality but do not directly cause partial volume averaging artifacts. Question 19. In light of recent developments in radiation protection guidelines, what is the primary advantage of automatic exposure control in CT imaging? A. EEC ensures a consistent level of radiation dose across different patient sizes. B. EEC minimizes radiation exposure by automatically adjusting the mass based on the patient's body part. C. EEC reduces the risk of motion artifacts by compensating for patient movement. D. EEC allows for higher image resolution at lower radiation doses. Answer. Correct answer. B. EEC minimizes radiation exposure by automatically adjusting the mass based on the patient's body part. Explanation. Automatic exposure control is a feature in modern CT scanners that automatically adjusts the mass based on the patient's body size, shape, and the area being imaged. This helps to minimize radiation exposure while still maintaining adequate image quality. EEC does not directly improve image resolution or compensate for motion artifacts, although it may help by adjusting exposure parameters to ensure sufficient image quality at lower dose. Question 20. In terms of radiation safety, what is the primary purpose of using a thyroid shield during an EK of the head? A. To reduce radiation exposure to the thyroid gland. B. To improve image quality by preventing radiation scatter. C. To protect the lens of the eye from radiation exposure. D. To shield the carotid arteries from radiation during imaging. Answer. Correct answer. A. To reduce radiation exposure to the thyroid gland. Explanation. The thyroid gland is particularly sensitive to ionizing radiation, and its protection is a key consideration in radiation safety. A thyroid shield, typically made of lead, is used to reduce the exposure to the thyroid during imaging, particularly in pediatric and young adult patients. While shielding does prevent scatter radiation, its primary purpose in this context is to specifically protect the thyroid gland from potential radiation-induced damage. Shields do not directly protect the lens of the eye or carotid arteries during head C. Question 21. In CT imaging, what is the primary purpose of using contrast agents in abdominal scans? A. To reduce the radiation dose to the abdomen. B. To improve the differentiation between soft tissues and tumors. C. To provide a clear outline of bony structures in the abdomen. D. To prevent motion artifacts during imaging. Answer. Correct answer. B. To improve the differentiation between soft tissues and tumors. Explanation: contrast agents are used in abdominal CT scans to enhance the visibility of soft tissues, blood vessels, and tumors, helping to differentiate between normal and abnormal structures. Contrast improves the contrast between different tissues and allows for better visualization of pathological conditions such as tumors, abscesses, or abnormalities. It does not directly reduce radiation dose, provide clear bony outlines, or help with motion artifacts. Question 22. Which of the following is most effective in reducing the radiation dose during pediatric CT imaging while still maintaining image quality? A. Using an adult CT protocol and reducing mass. B. Increasing the slice thickness to reduce the number of slices. C. Using a higher KVP setting for better penetration. D. Reducing the scan area to include only the relevant anatomy. Answer. Correct answer, D. Reducing the scan area to include only the relevant anatomy. Explanation: reducing the scan area to only include the relevant anatomy is one of the most effective ways to minimize radiation dose during pediatric CT imaging. This technique ensures that unnecessary body parts are not exposed to radiation. The mass and KVP settings should be adjusted according to the patient's size and clinical indication, and increasing thickness or using an adult protocol can compromise image quality in pediatric patients. Question 23. What is the main cause of streak artifacts in CT images when a patient has metallic implants? A. Beam hardening. B. Motion. C. Partial volume averaging. D. Scatter radiation. Answer. Correct answer, A. Beam hardening. Explanation: beam hardening occurs when X-rays pass through dense materials such as metals, which absorb and scatter lower energy photons, leaving the higher energy photons to continue through the body. This leads to streak artifacts on CT images. These artifacts are typically seen when metallic implants or objects are present within the scan area. Motion, partial volume averaging, and scatter radiation contribute other types of artifacts, but not streaks associated with metal. Question 24. What is the primary advantage of using multi-slice CT scanners over single-slice CT scanners? A. They allow for faster scans with better temporal resolution. B. They provide higher image resolution. C. They increase radiation dose due to more detectors. D. They allow for better visualization of large vascular structures in 3D. Answer. Correct answer, A. They allow for faster scans with better temporal resolution. Explanation: multi-slice CT scanners use multiple detectors to simultaneously acquire data from different angles, which allows for faster scanning times and improved temporal resolution. This is particularly important for imaging dynamic processes like cardiac imaging. While they can offer enhanced 3D visualization and resolution, the main advantage is the ability to form faster scans with reduced motion, artifacts, and better temporal resolution. Question 25. For a patient undergoing a ectomy of the chest, which of the following is the most appropriate way to assess lung parenchyma for subtle abnormalities like small nodules? A. Use a high-dose protocol to maximize image quality. B. Use a low-dose CT protocol to minimize radiation exposure. C. Reduce slice thickness to increase spatial resolution. D. Increase KVP for better soft tissue contrast. Answer. Correct answer, C. Reduce slice thickness to increase spatial resolution. Explanation: reducing slice thickness increases the spatial resolution of the CT scan, which is essential for detecting small abnormalities such as nodules in the lung parenchyma. High-dose protocols are typically unnecessary for detecting small lesions and may unnecessarily increase radiation exposure. Low-dose protocols and adjustments to mass should be balanced with the need. High-quality imaging in chest CT. Increasing KVP may improve soft tissue contrast but could also increase radiation dose without directly benefiting nodule detection. Question 26. What is the most significant factor contributing to the increased radiation dose in AKE of a pregnant patient? A. The use of intravenous contrast agents. B. The duration of the scan. C. The size of the scanning area and the number of slices. D. The presence of motion artifacts. Answer. Correct answer, C. The size of the scanning area and the number of slices. Explanation: the radiation dose in CT imaging increases with the size of the scanning area and the number of slices used. Larger scanning areas, especially when covering the abdomen or pelvis, expose more tissue to radiation, while intravenous contrast agents may increase dose slightly. The main contributor is the amount of tissue being imaged. Motion artifacts can degrade its quality but do not directly affect radiation dose. Question 27. In the context of CT imaging, which of the following best describes the use of iterative reconstruction algorithms? A. They primarily reduce the spatial resolution to improve image quality. B. They allow for higher mask settings to improve contrast. C. They reduce noise and allow for lower radiation doses while maintaining image quality. D. They require longer scanning times due to complex processing. Answer. Correct answer. C. They reduce noise and allow for low radiation doses while maintaining image quality. Explanation. Iterative reconstruction algorithms improve image quality by reducing noise, enabling the use of low radiation doses without compromising the clarity of the images. These algorithms allow for dose reduction while maintaining adequate image quality, which is particularly beneficial for pediatric and repeat imaging. Does not reduce spatial resolution significantly, nor does it require longer scan times. Rather, it enhances image quality in low-dose scans. Question 20. What is the primary disadvantage of using contrast-enhanced CT for imaging of a patient with a known contrast allergy? A. Contrast may cause nephropathy or worsen pre-existing kidney conditions. B. The presence of contrast in the body can obscure certain anatomical structures. C. Contrast administration can lead to severe allergic reactions, potentially life-threatening. D. The image quality may be reduced if contrast is used too early in the scan sequence. Answer. Correct answer. C. Contrast administration can lead to severe allergic reactions, potentially life-threatening. Explanation. Contrast-enhanced CT imaging may cause severe allergic reactions, ranging from mild symptoms like itching to life-threatening anaphylaxis, particularly in patients with a known contrast allergy. In these cases, alternative imaging modalities such as MRI or ultrasound should be considered, or premedication protocols may be implemented to reduce the risk of allergic reactions. Nephropathy is a concern with contrast agents, especially in patients with pre-existing kidney conditions, but the immediate risk for allergy is the primary concern here. Question 29. Which of the following is a key benefit of using a dual-entity CT DECT scanner over a traditional single-entity CT scanner? A. It can distinguish between different tissue types based on their atomic composition. B. It requires less contrast material for effective imaging. C. It reduces the need for multiple scans by providing high-quality images at lower radiation doses. D. It improves the temporal resolution for faster imaging in dynamic studies. Answer. Correct answer. A. It can distinguish between different tissue types based on their atomic composition. Explanation. Dual-entity CT DECT allows for the differentiation of tissues based on their atomic composition by using two different X-ray energy levels. This capability is particularly useful in identifying and characterizing tissue types such as calcifications, hemorrhages, and iodine contrast agents which may overlap in a single entity. DECT does not necessarily reduce contrast use or improve temporal resolution, but it does enhance tissue characterization. Question 30. We're performing an EK of the abdomen with contrast. Which of the following is the most appropriate phase of contrast enhancement for detecting liver tumors? A. Arterial phase. B. Venous phase. C. Delayed phase. D. Excretory phase. Answer. Correct answer. B. Venous phase. Explanation. The venous phase is typically the most appropriate for detecting liver tumors, as it provides optimal contrast between the tumor and the surrounding liver tissue. In the venous phase, the contrast agent has circulated through the arterial system and begun to be absorbed by the venous system, allowing for better visualization of solid masses. The arterial phase is better for visualizing vascular structures, while the phase and excretory phase are less commonly used for liver tumors.